some panelists with us who will be assisting us this morning as we brief South Africa and give them an update on the COVID-19 and the rollout of the vaccination in the country. So our panel of experts, we have Dr. Nicholas Crisp, who's the DDG in the Department of Health, who will give us an update on the vaccination program. We're also expecting to be joined shortly by the CEO of SAPRA, Dr. Boitumelo Simetle Makokotlela. And we also have Professor Oliveira, who will zoom in on the Lombard variant. And we also have the Director General of the Department of Health, Dr. Sandile Buthelezi, who's together with the Deputy Director General, Dr. Anban Pillay. They will be fielding some of our questions when we open for that. And we'll also be having, actually, she's on the platform, that's Professor Rees, who's a SAPRA Broad Chair, and will also be assisting with some of those questions that we'll be getting from members of the media. We'll be opening up for media questions. But at this point, Deputy Minister and Deputy Minister of Health, who's Dr. Joe Pahla, will be giving us the closing remarks as we bring the press briefing to a close. And before closing, then we'll take the questions for about 15 minutes or so and allow the colleagues to ask their questions on today's presentations. And we'll open up the chat for members of the media so that they're able to ask questions. And we also encourage the panelists to also respond via chat. And then we're also going to welcome now the Minister, the Acting Minister of Health, Minister Kubai, for her opening remarks. Thank you so much.
Thank you very much, Hlengiwe. Good morning to everyone who has joined us for the weekly media briefing this morning. As the numbers of infections, maybe let me first acknowledge the colleagues who have joined us, both in terms of our department and also the panelists that are joining us. I will list them as I go into the discussion, but I do see some of colleagues who are serving either in our MEX joining us. As we see today, we are seeing the number of infections as well continue to rise. Number of hospitalizations has been increasing so far, and also the number of deaths have increased. This means many of us are losing their loved ones, mothers, fathers, sisters, colleagues, friends. And this is because often when we see the numbers rising as South Africans, it never occurs to us that the numbers actually may include a loved one that is going to, until they are hospitalized or we lose them. So when we see the numbers, sometimes we see them as numbers until they hit home and it's somebody close to us. And then we start realizing what these numbers are just not numbers, but are people around us. And we continue to urge you as South Africans to be vigilant, take the necessary measures to protect ourselves as our families as well, our friends, our neighbors, and all people around us by continuously ensuring that we comply with the non-pharmaceutical measures that are helping us to break the virus and the transmission. In the last 24 hours, we saw 22,910 new cases being recorded, which represented a 30.4% positivity testing rate. Of this, Gauteng continues to account for more than any of the provinces at 11,747 new cases. Although indications are the number of cases in Gauteng are peaking and starting to show some level of going down, if you saw the peak, the graphs that are being circulated as well. However, Gauteng province remains the epicenter of the third wave, so we should never let our guards down and think that we are over yet. We're extremely worried about the rising numbers of cases in other provinces that are likely to follow the same trend, most notably Western Cape, Limpopo, Northwest, KwaZulu-Natal, and Mpumalanga. We are ramping our vaccination rollout program so that the vaccine can reach the majority of our population so that more people can be protected from this devastating impact of the COVID-19 virus. As we look, ladies and gentlemen, in what we have been able to do, we are encouraged and we continue to see more drives and initiatives by various provinces for increased mobilization for vaccination. Of note this week is the vaccine drive-through in Gauteng. We have also encouraged provinces to be innovative in encouraging South Africans to vaccinate. So the mobilization part is very critical so that you are able to engage those who might have questions about the vaccine and not being clear in what it means and how safe the vaccines are, because we continue to make sure that we engage South Africans and we can ensure that any concerns that they have are addressed and we engage them. We are encouraged that the number of vaccination per day have surpassed 191,000 yesterday at 5 o'clock, and we're expecting to surpass 250,000 vaccination by next week, by the end of next week. Overall vaccination, we are also happy to announce that we have surpassed the 4 million people who have received the vaccinations or the vaccines across the country. Now, this is one of the milestones, and though we note that many people are saying it's not yet enough because comparing with the percentage of the population, is still a bit of a challenge. And despite this strides as well, joined by South Africans, the Interministerial Committee on Vaccine, together with the President, still expects us to achieve more, and they have raised their concerns with us yesterday and giving us feedback on what needs to be done to improve and ramp up the vaccine program. This means that there is a lot of work that the team working on the vaccination program still needs to do. We have to make sure that the vaccine reach all South Africans as quickly as possible. We will now pay attention to vaccination per district and make the necessary intervention working together with provinces to ensure that in each and every district, in each and every municipality, there is local municipality, there is access to vaccine, and every South African have access to that, so that we continue to promote the equitable share of the vaccines across the country. This week, we held a bilateral meeting with National Treasury, where the matter for funding of the vaccination program was clarified. To this end, we'll be starting our work to ensure the availability of human capital to vaccinate over weekends as well. And we believe this will increase the capacity and will increase the work that needs to be done in vaccinating. Our target for this is the 1st of August 2021, and my appeal to the team working together with the provinces is to achieve this target. In addition to the persons aged 50 and above, on the 15th of July 2021, registration for persons of the age between 35 and 49 will open, and they will start vaccination from the 1st of August 2021. Dr. Nicholas Crisp will provide details on the progress of the vaccination program. And as I say, we have made strides, we have learned lessons when we started with others, and we continue to improve on our systems as we work and continue moving forward. And moving on the issue of vaccine approval, last week the South African Health Product Authority, on the approval of the CoronaVac COVID-19 vaccine manufactured by Sinovac Life Science for the use in South Africa. The approval came at a time when the demand for vaccines are more and more people are yearning to get vaccines. CoronaVac will boost the vaccine supply for countries' vaccination rollout program, in addition to those we already receive from Pfizer and Johnson & Johnson. And Dr. Cripps will also deal with the issues of the supply side as he presents as well. Following the approval, we are expecting an advisory from VMEC in order to take the process forward, and they do understand the agency of the matter. We are expecting to be joined by Dr. Boitumelo Smete Mokokotlela to give details on the approval of SAPRA and the processes that are followed, because we do believe that sometimes the public do misunderstand what the processes at SAPRA are and how they end up approving a vaccine and what led to the approval or the conditions that CoronaVac has and what has been done. And we want to continue to appeal, and I think the SAPRA has been doing quite well in engaging the public in recent few days, in ensuring that public understand where we are. Because sometimes there's misunderstanding that the approval comes as part of political pressure, and we want to actually set the record straight that there isn't, and we do not encourage anyone to want to put pressure on our regulators to be able to do their work. We must allow them to do their work on the basis of science and data that they receive. Scientists, again, on the issues of variants that we continue to see in the country and globally, scientists have discovered that there is a new variant that is even more transmissible, that is spreading in different parts of the world. This new variant is called the Lambda variant. By June 2021, the Lambda variant had begun to spread through South America and was detected in 29 countries in total, especially in Argentina, Chile, and Ecuador. Now it has been found in more than 30 countries. Contrary to the false reports I saw during the week that you might have also read, the Lambda variant has not been picked up yet by a scientist in the country. We are joined in this briefing by Professor Tullio de Oliveira, who will provide details about the Lambda variant and the progress we've been seeing with the Delta variant in the country. As I've already mentioned, we are also worried about various provinces, and we continue to give a platform for each province to give details of what they are doing and how we are managing the pandemic. This week, we'll be joined by a colleague from the Western Cape, Dr. Keith Klute, who will present to the public the COVID-19 situation in the Western Cape and the state of readiness for the third wave containment. In this briefing, we are also joined by the Director General of the Department of Health, Dr. Sandile Buthelezi, together with the Deputy Director General, Dr. Unban Pillay, who will be assisting in responding to some of the questions that members of the media and the public are asking us. The Deputy Minister, Dr. Joe Phaahla, has also joined us, and he will be doing the closing remarks he will help us with the questions, but also bring the closing remarks to bring this briefing to a close. Let me continue to thank the healthcare workers, the doctors, nurses, and all other supporting staff in the healthcare centers, all men and women in the sector who continue to be in the forefront of the fight against the COVID-19 pandemic. Again, let me appeal to you as South Africans to work with us in the fight against the pandemic. We want you to help us because we can't do this alone. As we roll out more and opening for more age groups, I want to also indicate that we are receiving a number of requests where people are saying to us, prioritize this sector. We have presented to the IMC the constraints and what we see as a danger and the difficulties will hit on when we go ahead if we continue to approach the vaccine rollout on the basis of sectors. We are reviewing this, and once it's finally approved by the IMC, we'll communicate. We do believe that the age gap or the age process continue to be the best and less logistics, less administrative process that could assist us to reach more South Africans. So as we open for more ages, please, South Africans, this is your opportunity. Take it up. When you go, don't go alone. Take your neighbor. Ask the person next to you if they are in the same age group that have been opened, whether they would need a lift or whether they will need details of how to access the vaccine. And let's work together to ensure that we vaccinate the nation and we protect South Africa. Thank you very much.
Thank you so much. We will now request Dr. Professor Tullio de Oliveira to give us a briefing.
Good morning, Minister Kubai, Deputy Minister Joe Phaahla, DDGs, media and the public. Yeah. So in the next 10 minutes, I'm just gonna give you a brief on the update on the variants in South Africa and how this is really driving the very severe third wave. Yeah. So I will just start to share my screen, and I hope you can see now my full screen. So that is just an update that I have done with some colleagues. I'm going to be speaking today, but I would like to acknowledge some colleagues, Rudy and Dr. Richard Lessels, but also part of a whole network, the Network for Genomic Surveillance, which is funded by the Department of Science and Innovation and contain most of the many universities, the NHLS and the NICD. I will, for simplicity, I will start with a summary and I will finish also with the same summary. Yeah. So the summary of this presentation is Delta is now rapidly become the dominant SARS-CoV-2 variant globally and South Africa. Fast increase of Delta is translating to fast increase of deaths in low vaccine coverage countries. The epidemic still expanding in South Africa. We are not out of the woods. Now, with the other provinces, what we're going to show very clear that Limpopo, KwaZulu-Natal, Mpumalanga, and Western Cape is showing a very fast increase of cases driven by Delta. New evidence confirmed that Delta vaccines even better than the previous Beta variant. Other vaccines, other variants of concern are very rare in South Africa. Delta Plus and still not detected, or the Lambda has not still been detected in South Africa and Africa. Yeah. So it's always worth to start the presentation with just to see what we know from the genomic surveillance. Here in the x-axis, we have data. Our most recent samples now come from the beginning of July, and the y-axis is the proportion of the genomes. Whereas the first wave was dominated by many lineages, the second wave saw the emergence of the
colleagues. How are you? I'm good. I'm actually can't talk.
Thank you. I'm mute.
And then apologies for that. And then we had the introduction of another variant, not the Lambda, but the Alpha variant, until the Delta variant continues to increase, and at the moment, almost dominating all the infections in the country. Yeah. What's happening in South Africa here, that's in the red line, now we are presenting confirmed deaths by million of cases. We see this very fast increase of death. But here, the Delta variant's now in green. Unfortunately, what's happening in South Africa is happening in many countries around the world with low coverage vaccination. Russia, it see a massive increase of deaths as the Delta variant starts to dominate. Indonesia and Bangladesh. Indonesia and Bangladesh is very worrying because the sheer size of the population, we are talking about hundreds of thousands of deaths. So just to understand what is happening in South Africa, and I am aware that everyone knows the epidemiological curve, yeah, but here is the first wave with different provinces, colors in different colors. Here's the second wave. And as you are aware, the third wave has been extremely severe in Gauteng. But what we saw this week, it is that the reproductive number of the infections, what it means, how fast is growing the other provinces, is the highest in Limpopo, followed by KwaZulu-Natal, Mpumalanga, and Western Cape. Despite the numbers not being extremely high there, we see a very, very, very fast rise. And what I'm going to show that's really caused by the Delta variant. We see a slightly decrease in Gauteng on the reproductive number, but I think that we are still not out of the woods there because normal infections will follow that. Yeah. So let's go to Limpopo. Limpopo increased genomic surveillance with the National Institute of Communicable Disease. And here we have a number of cases in black. And can you see how fast it's looking like almost a rocket launching? Yeah, not much different than the beginning of the third wave in Gauteng. And that's associated again with a fast increase and start domination of the Delta variant, which is here in green. So that's why Limpopo is showing such a high increase. And now with over 1,000 cases in a 7-day rolling average, yeah. Unfortunately, the same is happening in KwaZulu-Natal, and I show you that last week. As the Delta variant start dominating green, KwaZulu-Natal also entered a very fast rise of infections, which still in lower numbers for the size of the province, or not relatively lower numbers, but increasing very fast, the second most fast increasing province on number of cases, yeah. Mpumalanga, we are completing now the genomic surveillance. We should complete this week, but we saw again the Delta variant start to grow, and just after that, is starting shooting up the number of infections, which we expect to confirm that's the case as the last 3 provinces that I show you. The same unfortunately happened in the Western Cape. The Western Cape is still increasing larger the number of numbers, and again, very fast increase of the Delta variant. And in Gauteng has been the most extreme case. Again, Delta variant increasing almost linearly the prevalence with the number of cases, a small decrease. But unfortunately, what came yesterday by the Medical Research Council is that the number of excess in deaths in Gauteng already has been the highest of the history. So just to summarize what's the Delta variant we know is very fast advancing knowledge coming. It's very clear around the world, not only in South Africa, but both in Russia, in Southeast Asia, in Europe and the United States, that's really highly transmissible, potentially twice more than the other variants. One thing that is getting much stronger, the evidence, is that the vaccines show high level of protections against severe disease. And I would just concentrate a little bit on very recent data that came on the vaccines. Yeah. We have presented that last week, but it's good to remind that this is data from the UK, which is also dominated by the Delta variant, that even the first dose of the Pfizer vaccine, what's being rolled out in South Africa, will show a very high effectiveness against hospitalization and death. And I personally find that's really, really important to get the first dose in as many individuals as possible to protect our health system. Yeah. So I just want to bring that's the same with 2 doses, yeah, on the hospitalization. We also seen that the AstraZeneca is more effective against the Delta variant than the Beta variant, and I will bring more information next. But what came yesterday in one of the most prestigious scientific journals, Nature, yeah, is really the confirmation that what we have a body of evidence that if you have the different variants, the Alpha, Beta, and Delta, and you have different vaccines, just shown here at Pfizer, that the Delta variant is going to have much higher level of antibodies. What it means that the vaccines are more effective against the Delta variant than what we had in South Africa before the Beta variant. This is also new data released by the J&J vaccine that's being rolled out in South Africa. The Delta variant is also known by the B16172 and the Beta as the 351, and confirming that the J&J, which was already effective against the Beta variant, has stronger antibodies against the Delta variant. So we should confirming that the protection will exist and potentially stronger than the Beta variants. Yeah. So just to summarize, vaccines seem to be more effective on the Delta than the Beta. And that's a big importance of increased vaccination. First dose will protect hospitalization, and second dose will protect symptomatic. And that will allow, as our Minister Gubai say, to increase the basket of vaccines in South Africa to be available to the population. As Minister Gubai comment, yeah, we also have been keeping a very close eyes on other variants of concern or variants of interest. One of them is the Delta plus. What it means is the Delta plus 1 mutation, which seem that make a little bit stronger the Delta. However, that one has not picked up either globally or in the United Kingdom, which has the biggest genomic coverage in the world. And in South Africa is also a very small prevalence, very similar as the global prevalence. There was a lot of concern about the Lambda variant. And why is that? Because the WHO, which I participated in the evolution working group a couple of weeks ago, have raised this variant to a variant of interest, which is causing big havoc in Peru and other countries in South America, and has been detected in 31 countries. However, that's not yet detected in South Africa. And with colleagues of the Africa CDC and many organizations in Africa, which will increase genomic surveillance, has also not yet been detected in Africa. At the moment, the whole scientific community is very interested about that variant. They are following that very close, but at the moment, there's no evidence that would become a variant of concern. May change in the next few weeks, but at the moment, the main variant that we are concerned in South Africa and globally, it is the Delta variant. Why the Delta variant is so concerning? Because becoming the dominant SARS-CoV-2 variant globally, in South Africa is very, very high transmission as we have never seen before, which the transmission is not about numbers, but is very fast increasing deaths in low vaccine coverage countries. The epidemic is still expanding in South Africa. It haven't stabilized, may have stabilized in Gauteng, but the other provinces, especially Limpopo, KwaZulu-Natal, Mpumalanga, and Western Cape, is showing a fast increase of numbers driven by Delta. New evidence confirmed that Delta is well neutralized by vaccines, even better than the previous variant circulating in South Africa. And the other variants of concern are very rare, is still in South Africa and globally, the Delta Plus. And the new variant of interest, the Lambda, has not been detected in South Africa and Africa. And as soon we detect it, we will highlight to the public and we will follow that very clear. But at the moment, globally, is no evidence that the Lambda is overtaking the Delta in any country in the world. So thank you very much for this opportunity to brief the media and the public, ministers, deputy ministers, and DGs. And just to highlight that this work is the work of hundreds of scientists across the countries in very close collaboration with many universities, the NHLS and the NICD. Thank you.
Thank you so much, Professor De Oliveira. We are now going to move on, and we are going to now zoom into the Western Cape. Now, as you all know, we are seeing our surge there, and I am going to now request that we call Dr. Klute, who is with us on the platform, to give us an update on the surge plan in the Western Cape. He will give us a brief presentation. Thank you so much.
Thank you very much. Good morning, Deputy Minister, and thank you very much to all the colleagues, and good morning to everyone. Just to give you a picture of the Western Cape, this is from our public-facing dashboard that we update every day. And you will see, if you do a consolidated picture, the gray bars is the cases. So we are solidly in that third wave, as pointed out by Professor De Oliveira. All our markers on the screen, the green marker is daily oxygen use, the blue marker is hospitalizations, the red marker is daily reported cases of death, and the yellow marker is proportion positive of laboratory tests. You can see all those markers are on an increase. The reproduction number, also quoted by Professor De Oliveira, is currently at about 1.2 or 1.19, as the Professor De Oliveira has indicated. And that is meaning that we are increasing our cases and we are in the inclining phase. This is our picture, our provincial view. We're currently seeing more than 2,000 cases now, a new diagnosis per day. It's about a 29% increase week on week. Our proportion positive is now 32% in the province, and we're currently seeing about 170 to 180 new admissions in hospitals, and we're seeing about 35 deaths per day. So those are the increases that we're currently in. If you compare to the MRC excess death report, you can see the Western Cape and the Cape Metro has now broken through the upper bounds of expected deaths. And we're obviously watching this, and we're calibrating our deaths very closely with this MRC report in terms of excess deaths. What we've done in our province is to compare the three waves. So you see the light blue is the first wave, you see the dark blue, the second wave, and you see the brown one being the third wave. The third wave is possibly slightly slower now than it was initially because it was tracking very close to the second wave. We have exceeded our first wave. We also continue to see different patterns, and this is very much in line with our seroprevalence picture in our province. So if you take a place like Khayelitsha, you will see a very steep first wave, a flatter second wave, and now even a more delayed third wave. So the seroprevalence data does seem to bear out in terms of the protection that we have potentially about the size and the scale of a third wave. Obviously, the modeling consortium is currently updating their third wave expectations, and they're taking Delta into account. We're getting a briefing from them next Monday afternoon, but their short-term predictions for new cases have been tracking pretty well to what we've seen. You can see that the gray is what they have as their forecast. The black dots is the actual data, and you can see we're at about 2,000 cases a day that they predicted. They are predicting quite a sharp increase towards the middle of July. For us to go up to about 3,000 cases a day, we obviously have to track over the next 2 weeks to see what's going to happen. But the forecasting of rising numbers is slightly slower than what it was before. The short term for admissions is that we are going to increase from about 300 admissions to about 500 admissions over the next 2 weeks. We have a Western Cape third wave advisory, very much based on the MAC advisory. And we had these 4 levels of trigger of our response. So it's a 4-level trigger system. We're currently in the 3rd level. You can see the 3rd warning. You can see more than 20% week-on-week increase in the 7-day moving average for current admission in hospitals. And we also have now more than 50% of our high care and intensive care and high flow nasal oxygen capacity occupied. So we're triggering our 3rd wave, 3rd warning response for our preparedness. So what does it mean? We are in the midst of a mitigation paradigm in our province. We have a 5-point strategy to deal with it. The first one remains the community behavior. We still believe that people can still flatten any wave through behavior of mask wearing, social distancing, and especially avoiding gatherings. Our outbreak and surveillance response now shifts towards protecting the high risk. Then now, number 3 is the scaling up of our COVID capacity. That's what I will explain a little bit more detail while we scale down other services in our service. And number 5 is that we've protected our healthcare workers by giving them vaccination. And now we're expecting healthcare workers to do vaccination plus manage COVID and comprehensive services. So our acute service platform scaling capacity, our surge capacity, we've been actively de-escalating non-COVID services, both in primary care and hospitals, to maintain absolutely essential care. We've done it very much the way we've done it in the second wave. We've learned very much our lessons of how to do it. Also, our acute hospitals, we've progressively started demarcating PUI wards, COVID wards, and COVID critical care capacity to a full planned capacity of 2,300 public sector COVID beds, inclusive of our field hospital capacity. That's what we had at the peak of the second wave. Our field hospital capacity, also what we've done is a stepwise full commissioning of all the field hospital capacity. We've kept all the field hospital capacity of the second wave, but we scale down activity as we move between waves. And as we're now moving into the third wave, we've brought that capacity back online in a systematic stepwise way. So Brackengate has got 335 bed capacity. Mitchells Plain Hospital about 200 bed capacity. Frisia and Ward 99, 86 capacity. Solstraal in Paarl 60. And then at a lot of rural hospitals, there's 20 beds, 30 beds, 20 beds capacity across our entire province. But the big thing for us is number 4, our coordinated platform response. And it's about coordinated movement of patients coming into emergency centers, into acute and critical care beds, into field hospital beds, and then streamlined discharges. The basic premise of our system is that we take the pressure off the point where the sick patient must present. That's the EC. We move the patient out of the system in a very quickly way, and that's what we've learned in the second wave. The big thing we've learned in the second wave is additional staff. We employed additional staff, up to 17,000 people. We've retained them from the second wave with flexible deployment and contract extensions. And then the last one is we learned a lot about oxygen capacity. We have daily huddles for coordinated, uninterrupted oxygen supply and distribution in line with the oxygen utilization need across all the hospitals. This is our current picture. We have 2,200 people now currently with COVID in our hospitals in Western Cape, 960 in public hospitals, 1,300 in public and private hospitals. And the intermediate care facilities, Brackengate, currently has 133 patients. Frisia, Ward 90, still no patients. Mitchells Plain Hospital, 47. Swansdale, 39. So you can see that we are progressively increasing that. We also have a mass fatality center where all the bodies are processed just to make sure that there's no backup of bodies. And we work very closely with municipalities, undertakers for a streamlined process in the province. This is our daily dashboard. See, according to our dashboard, we got 7,600 operational public sector beds. They currently occupied about 80%, but only 16% of that capacity is currently taken up by COVID. Towards the peak, it moves to about 33%, and that's what we titrate every day. We've also been tracking the impact of trauma on our system. So you can see that from the week before the full ban on alcohol to the first week after the full ban on alcohol, we've now had a 25% decrease in trauma at our hospitals. This is measured at 17 emergency centers in the Western Cape, mainly in the metro. And we've also had the weekend trauma, the peaks reduced by 33% after this. Oxygen, we're currently using about 47 tons with public and private together. Public sector, about 23 tons per day. And we are working with AFROX to scale our capacity as needed. And this is looking after our workforce. You can see 833 staff additional for COVID, 775 additional for the vaccination drive. And we're doing a whole range. And in the Western Cape, 67% of all our staff working in the Western Cape Department of Health has been vaccinated. And we're seeing a big impact in terms of fewer people being infected, fewer people being hospitalized, and no deaths from people that have been vaccinated so far in the Western Cape. This is our vaccine administration, just to end off. And as the Deputy Minister, the Acting Minister was saying, this past week have seen a big increase. So we have so far in the Western Cape vaccinated 600,000 people. For phase 2, we have now vaccinated about 480,000 people. And in this week alone, for the first 4 days, we have vaccinated more than 130,000 people in 1 week. So we now, in this week, recorded 29,000 vaccinations in 1 day, 2 days ago, 28,000 vaccinations yesterday. So we are ready to scale above 30,000 vaccines in the province. We've also opened Vaccination Center of Hope at the CTICC earlier this week. And this has the capacity to do 4,000 vaccinations per day. And we'll also have the capacity to go to work 7 days a week over weekends. This is a cascade that we're now building up. So you can see there's 720,000 people over the age of 60 in the Western Cape. 348 of them, 1,000 have already had their first dose. So almost 48% of all the people over 60 has had their first dose. And now we're tracking 50 to 59. And as the other age groups will go, we will also track that. So in conclusion, we are in a steep wave driven by Delta. We are asking everybody in the province to adhere to protective behaviors. We anticipate that our third wave could be as high as the second wave, but we await the revised modeling, which we will have early next week to recalibrate our response. We've anyway revised our preparation with clearly articulated triggers and appropriate health platform response, societal response. We in this province need a whole of government, whole of society response to flatten the third wave. We've scaled up our vaccine capacity, and we are now ready to scale up rapidly with the capacity that we've created. And obviously, we need to mobilize and assist everyone over 50 to be registered and vaccinated. Thank you very much.
Thank you so much, Dr. Klute, for that update on the Western Cape preparedness towards the surge. And I will now move on to Professor Simete Makokotela on the excuse me, on the SAPRA vaccination approvals. Thank you so much.
Good morning, everyone. I'll just share my screen, please, if you don't mind. Okay, I trust that you can see my screen.
Yes, it's visible.
Thank you. Good morning, everyone. Good morning, Minister, and the other colleagues. I'll just give a very brief presentation on the current status of the vaccine applications within SAPRA. I'll also share some of the, a lot of work that goes on in the background in terms of what we call the pre-submission meetings. So overall, we've met with a number of applicants at SAPRA. We started with these meetings around November or so of 2020 with the first what we call pre-submission meeting. So this is when the applicants request to meet with the regulator to indicate their intention. They present to us the type of data that they have, and we guide them in terms of the requirements. So late last year, we met with a number of companies, Janssen initially. We also met with a number of companies that were intending to bring in the AstraZeneca vaccine. We met with Pfizer early in the year, and now they had submitted and have been authorized. We also met with Lamar Pharmaceuticals that was intending to submit the Sputnik 5 vaccine with Numalax Curanto. Dr. Reddy's, who was looking to submit for the Sputnik application, as well as another vaccine that we haven't received an application for, but this is a multi-epitope peptide vaccine. And the company we met with was Vaccinity. They still, have not submitted at this point. We met with a company called Solace for CoronaVac. This is the Sinovac vaccine. We also met with Bharat Biotech. This is a vaccine that's been authorized in other countries like in India, and they were also indicating that they would like to submit to SAPRA, and we took them through the process. And we also met with LAC Pharmaceuticals for Sinopharm. And these meetings continue to be available to the applicants. In terms of the authorization status, we have the AstraZeneca vaccine that had received a Section 21 authorization, the Pfizer vaccine that also received a Section 21 authorization, the Janssen vaccine, they received a conditional market authorization. And maybe I can pause here to talk about what is the difference. So Section 21 is a mechanism that we have in the Medicines and Related Substances Act that enables SAPRA to give an emergency use access. This is a mechanism that, under normal circumstances, we use for a number of medicines that are unregistered in South Africa and could then be accessed on a patient name basis. So we had to modify this mechanism to make sure that it is relevant for the response to COVID, specifically these vaccines. So for specific applicants, we've then given this emergency use authorization, and it comes with conditions wherein we indicate the type of data that is still outstanding and must be provided. A conditional market authorization is where we've got a lot more data having been made available. And typically with a conditional market authorization, it's under what we call a rolling review submission. So as you note, with Janssen, they submitted their application on the 4th of November, 2020. It was a rolling review. So as the data became available and been generated, that they then were able to get conditional. Again, it also has conditional. So what you will find in terms of compliance with the Act, this authorization is listed on our website, but we do not list then the Section 21. A number of the Section 21 applicants have also asked for a rolling review submission. So we are continuously reviewing those hoping to issue a decision on market authorization. We've also recently then issued a Section 21 authorization for Curanto Farm for the Sinovac CoronaVac vaccine. We currently are reviewing 2 vaccines, wherein we've got a number of applicants. Firstly, the Sputnik V. We've got 2 applicants for that vaccine, and it's currently in review. We have Sinopharm, also that's been submitted by 2 applicants. The latest application we received was last night. So those are the ones that are currently in process. And possibly a question that would come is, what is the difference and how do we review these? So again, because these vaccines are manufactured in different sites, we always first start by looking at what we call the good manufacturing practices. And where these vaccines are manufactured, we assess the inspection sites through collaborating with the authorities in the respective countries. And then we do the evaluation. So there are instances where the dossier is the same, and we will do a single review. There are instances where the dossier is different. It could be that the manufacturing site is different, and we then review that separately. And then lastly, I thought I'll just take you through the process that we go through in reviewing all of these vaccines that I've just indicated. So first, we look at the applicant. All the applicants have to be licensed with SAHPRA for them to be eligible even to be considered. And so that's the first aspect that we look at. And it is important that they're licensed, because that's where we look at their capacity to monitor the vaccine as it's then being made available in the market. We also look, as I've indicated, at the place where the vaccines are manufactured. So we look at, does it comply with good manufacturing practices? We look at how they do the packaging and all of that. From a production perspective, we look at the actual product, and we look at the quality of that product. We look at its chemistry and all the validation tests that are conducted to make sure that the product is a quality product. And then the fourth step is looking at what we call the non-clinical assessment. So we look at their preclinical studies. So studies done probably in animals to look at the toxicity and to ensure that it is then ready for clinical assessment, which is then the fifth step. We then look at all the data that's been generated for phase 1, phase 2, and phase 3 clinical trials that have been conducted, looking at the safety as well as the efficacy. And we also look at, as we have indicated, the quality of the vaccine. And then if it meets all the requirements, we would then issue an authorization as indicated, whether it's Section 21 or a conditional market authorization. And if we make a decision wherein the applicant is not satisfied with the outcome of the regulator, there is a mechanism in the Act that enables them to appeal the decision of the regulators. Under Section 24A of the Act, they can appeal the decision with the CEO. And if they're still not satisfied with that outcome, there's a further step that enables them to appeal the decision through the Minister of Health, who puts together a committee that would then review that decision. And so far, we haven't had any appeals. And then the last step, very important, is that as SAHPRA, we also manage and have oversight of the product along its life cycle. So once it's authorized, our work doesn't stop. We continue to monitor the product from a safety perspective. We've recently launched the Med Safety app, wherein we're getting feedback on any adverse effects following immunization or adverse effects of special interest. So we work and we analyze that. Also, we do what we then call post-market surveillance. And very important is that every vaccine that arrives in the country, it has to go through lot testing to make sure that the quality of the product that is subsequently in the country is the same quality that we would have authorized. So quite an intricate process that goes through authorization of a vaccine. Thank you very much. I'll pause here.
Thank you so much, Dr. Bitumele Semete Makokotlela, for that briefing. We are now going to swiftly move on to the DDG in the Department of Health, which is Dr. Nicholas Crisp. He's going to be giving us a status on the vaccination rollout program and give us some clarity also on the focus groups and the vaccination, private and workplace, including some case studies. I suppose let me hand over to Dr. Chris so that we're also able to cover time. Thank you so much.
Okay, thank you very much. Morning, Minister. Morning, Deputy Minister, members of the media and colleagues. Thank you very much for the previous presentations. I think the important starting point is that you've just heard that we have that vaccines are safe, reliable, and effective, and that the vaccines that we are currently using in the rollout do work against the variant that we are dealing with. That's a very good and important starting point, and it reaffirms that vaccination is so important as part of what we do. But as the Honourable Acting Minister said in the beginning, and we've heard from Dr. Klute, this is not the only way to deal with the spread of the virus, and we encourage everybody to continue with the non-pharmaceutical protections. In the interest of time, I'll just go over a couple of points and not go into too much detail. Just in terms of the reach for the vaccination program at the moment, we have moved from the first day where we had 113 vaccination sites, 110 in the public service and 3 in the private sector. We now have operational 2,283 sites in the public sector and 314 in the private sector. There's an ongoing project between the public and the private sector where we examine the data at site level, at local government level, and at district level on a continuous basis to try and identify where there are deficiencies in terms of coverage capacity. Now, most of these are fixed sites, and most of these sites, particularly in the rural provinces, do a lot of outreach. So they are getting to a far wider range of geographical areas for providing vaccines. Even some of the private sites are now also starting to do some outreach services so that we can get to communities that are a little bit further from the major centers. This will continue to roll out, and we will continue to add sites that are available for vaccination. Just by way of the distribution, I'm not going to go through all of this, but it's available so that if the media would like to report, these sites are listed on the website. They're changing every day, and some sites actually do close down. They don't get shut completely because we may need to go back to use them again when there are different target groups in the demand cycle. But they are moving to where the population demand is at that point in time. But there are sites spread all over the country now, notwithstanding the fact that we're aware that there are a couple of places that don't have sufficient sites still. In terms of vaccination, you heard some of the high-level statistics from the acting minister. The number of people who have been vaccinated since the 17th of May is over 3 million. And in fact, it's now, we're moving at almost 200,000 additional vaccinations a day across the country. Yesterday was 191,000. Every day this week has been over 100,000. Our target, as you heard, is to get to 250,000 by the end of next week. And that means that all the private and public vaccination service providers are ramping up their capacity, as you also heard from Dr. Klute in the Western Cape with their plans. This is a significant improvement from the 85,000 per day we were doing about 10 days ago, but it's still insufficient for us to say that we are moving at sufficient speed. And our overall target is by the end of August to be doing at least 300,000 vaccinations a day. What this means is that together with the Sosonke study, we have reached 5.6% of the population with at least one vaccination. Obviously that is way too little to get herd immunity. But in the population groups, as you also saw from Dr. Klute, around half of the target population in the plus 60 has been reached. And it's pretty much the same across the provinces, some a bit higher, some a bit lower. And now with the 50 plus population having recently come in, we are tracking the percentage of that population that is covered. I'll quickly show some of the vaccinations per province so that you can get an idea. You can see on the table, it shows you the actual numbers of vaccinations done to date in that province. These figures will always be the lowest possible figure because in many vaccination centers, there are still some records that are captured on paper and only added afterwards. It does happen when there are power failures from time to time and for a variety of other reasons. We don't encourage it, and there are processes to back capture that data so we're able to report an accurate figure. But these are the audited figures at night every single day. On the top right of each of these slides, you will see the numbers of vaccinations in each of the districts of the province, and below you will see the timeline since the 17th of May when the national rollout started. And the dips are obviously the weekends, and those are the areas that we now need to address, and I'll talk about briefly in a minute. So as long as we are seeing a general trend going upwards, and the faster that trend is going upwards in vaccinations per day, we at least know we're moving in the right direction. So the Eastern Cape is making good progress. The Free State had a spike where they were catching up with vaccinations after some disruptions in their program. And now they are on a relatively flat level and are busy making plans for accelerating their vaccinations per day. Gauteng has had a relatively consistent and flat vaccination since the 17th of May, but they've started new programs. You heard the minister allude to one of those with the drive-in that was started, but there are further outreach programs that have been started by the Gauteng department. They are obviously experiencing the brunt of the third wave at the moment, and it makes it a little bit more difficult for their vaccination program, but nonetheless, they are also scaling up activities. In KwaZulu-Natal, they got off to a very good, fast start with a number of large vaccination sites prior to the third wave, especially in the busy, larger, more densely populated parts of the province. That then decreased as they started to provide the services in the wider, more rural parts, which are more difficult to get to. But they have had some initiatives, as you can see, in the week between the 20th and the 27th of June, where they again managed to get into a high density population and do a lot of vaccinations. This program it's stable, but it will now pick up as well. Limpopo has done consistently well with a very pointed program where their councillors, traditional leaders, and church leaders in particular have got together with the political leaders and done a lot of direct outreach into communities, taking their vaccination services with them, which in a rural area appears to be the smartest way to do it. And they have had, as you can see, a meteoric rise in the numbers of vaccinations. Now that they are getting to slightly more difficult to reach communities, it went down a bit. But with the introduction of the new age category of 50 pluses, they are once again starting to pick up their daily vaccination rate. And Mpumalanga has had during the week of the 20th to the 27th, when they picked up, it was when we started to vaccinate the educators. But this program is also on a general upward trend. In Northwest, you can see the same peak during the vaccination of the educators or the education sector, but their trend is also generally upwards on a daily basis in all their districts. There are a number of additional initiatives in both Limpopo and Northwest, which should pick up quite dramatically in the near future, because they have a lot of mines and there are projects to get to the people in those mining communities, and particularly to mine workers. Northern Cape has a whole set of different challenges from the rest of the country because of the geography of being so spread out. Their whole plan was premised on the use of the Johnson & Johnson vaccine. And unfortunately, as we know, we were unable to get the Johnson & Johnson vaccine until very recently. So they had to redesign and reorganize their entire program. So they got going quite slowly in the first couple of weeks, but they have accelerated very rapidly since then and now have a very coherent plan to reach their communities. The Western Cape, you saw from Dr. Kluter, and all the districts, it looks like everything happens in Cape Town, but that's because that's where the concentration of the population of the province is. And they also have the same type of problems with the faraway, distant rural areas, but they are doing outreach. And you can see the trend that Dr. Kluter was referring to is very definitely steeply up. and now with the introduction of their mass capability in the city of Cape Town, I'm sure we're going to see that go up again. So in terms of ramp-up strategies, I'll just show the one slide and I'll talk to it. So there are a number of initiatives that are all happening in parallel. And I want to emphasize that it's not either or, they all happen at the same time. So as Dr. Klute was referring to in the Western Cape, all the provinces are busy with their particular ramp-ups of their primary healthcare services, using all of their clinics as far as they possibly can, and using other staff from elsewhere in the service to ramp up vaccination services as the foundation of the program. The second one is that we have a number of mass vaccination sites, as you heard, already operational in a number of the provinces, but there is a plan for donor-funded additional capacity to provide to a number of the provinces with highly concentrated urban populations. And we hope to bring that online shortly. The private sector capacity is largely concentrated on pharmacies and hospitals, but there are a number of other groups who are now also providing vaccinations. And in this particular project, parallel project, the trick has been to make sure that they are not only seeing insured people on medical schemes, which was the case at the start of the program. Now we are referring anybody, whether insured or uninsured, to any site, and the private sector is vaccinating the general public who are uninsured as well. Then there are two parallel activities in the occupational health stream. This is where companies and government departments have capacity for vaccinating employees, and in some cases, employees' families. And what we are doing is leveraging those workplace programs. For instance, mines have clinics and hospitals, and a number of other retail industries have their own workplace programs with their own nurses and doctors. And they are also now involved in vaccination programs. And when they are completed with the workers, all of them have said they will move into the communities around them and they will vaccinate to bolster the primary healthcare and district capacity. That is also happening in the public service programs, where a number of parallel efforts are going on that you should be aware of in the media already. The first was the education sector, and now the police, defense forces due to start today. And there are a number of other departments that are also being vaccinated in this similar program. So the idea is to use every single potential capacity of nursing and doctors and a number of others to increase the vaccination tempo. So the minister's already referred to some of the strategies that are going to change. The one is to bring the younger cohorts of the population into the demand cycle earlier, and she's already announced how that will function. We are busy getting ready so that we make sure that that runs smoothly. We did note that when we brought the 50+ population in, people did not understand the difference between registration and vaccination and started to arrive in large numbers prior to the commencement of vaccination. We would prefer to get a chance for the older population to be vaccinated first, but we will be ready for vaccinating shortly after we open for registration. The question of weekends has been a big issue from the beginning, and I think we've all been on record saying we didn't have the capacity to vaccinate over weekends with staff and so forth. There are a number of programs going on. Dr. Klute has alluded to this in the Western Cape. All provinces are busy making plans that at least some of their sites, they are able to get additional staff. And we're very grateful that a large number of students from health sciences faculties around the country and colleges, nursing and other colleges, are making themselves available to the provincial departments to bolster that capacity. Clearly, those students all work already in the health sciences, and this is something that they should be able to do. They will start by working in the provincial departments with their colleagues to get used to what is required, and they will form an additional staff capacity to accelerate weekends when they're not primarily engaged in their studies. So those we should see happening in the near future. Just one last comment from me is that we are aware there have been many complaints or comments from the media about the figures that are available in the public space. The new dashboard went live last night, Now that we have first and second dose Pfizer and the Johnson & Johnson vaccine, and potentially in the not too distant future other vaccines, we need to be able to show them clearly. And those figures are now being reflected separately and are being reflected for the public and the private sector in the new dashboard. So we hope that that is going to make it easier for you to see what is going on and to report. And if there are comments, we would gladly receive those comments. So I'll leave it there for the report for this week. Thank you.
You're muted, Hlengiwe.
Apologies for that. Thank you so much, ladies and gentlemen, for still remaining here with us. Thanks, Dr. Chris, for that insightful presentation as well. We are going to now move on to our question and answer session. Members of the media who are on the platform have already posed some of the questions, and some of our panelists, expert panelists, have been able to respond to those. I will just proceed and read out some of the questions, and I would really encourage our panelists to just respond to those which apply to them. We also have the Director General of the Department of Health, Dr. Sandile Buthelezi, who is joining us with Dr. Anban Pillay and also Professor Helen Rees, who will be fielding some of those questions. And Minister, I suppose Minister will take those also addressed to her, and she will come at the end as well, I think, at this point. We will then have our Deputy Health Minister, Dr. Phahla, who's going to close. So now I'm going to start reading the questions. The first question is from Arisa van Rensburg from Netwerk. It goes like this: did you recommend that President Cyril Ramaphosa keep level 4? So Minister, that's just basically about the current lockdown and whether we're moving to a higher level or not. And I think that question will then be addressed by Minister. And the other question is directed to Dr. Boitumelo. It says, why are we seeing different process lengths for all these vaccines? What takes so long for vaccines to be approved? And Kutwan is referring to Pfizer and the dates that it was applied to and that it got approved. But in terms of the other dates, so it's basically a question around the dates and the different dates thereof. Why is it the case? And Heidi is from ENCA. She's asking, how many vaccines do we currently have in stock? I think Dr. Chris will take that. And he has highlighted, in fact, some of the aspects around vaccination. And the other question from Heidi still, are you still worried about the low turnout for 60 plus? And if so, what are you going to do about it? And we also have a question still from Heidi. We have heard nothing on the Aspen facility releasing JJ vaccine. Is all okay? What's the latest there? And then the last question from Heidi, the recent stats on the dashboard show not even 400 have received the JJ vaccine for the national program. I suppose Dr. Chris indicated just as he closed about the numbers there. So Heidi is saying it's a bit confusing. Maybe if Heidi has not been clarified, Dr. Chris can take that question as well. And we also have Andile Marubi, Minister in panel, with the approval of Sinovac. When can we start seeing an increased number of people actually taking the vaccine up? And for those aged 35, can they walk in and will they be vaccinated? Or so the question is around clarification exactly on the process. If I go to the vaccine side, am I going to be vaccinated, or what happens if I'm 35 and above? The other issue is from Sharma Duplessis, also asking about the numbers, saying the math comes from a total doses given and announced by African CDC. So it's just numbers, Dr. Chris, but I suppose maybe colleagues would have been clarified at this point, but I suppose you can take it as well. I will leave, maybe let me read out the last one and then we'll then open for the next session. Megan Lawrence, that's been taken already. Okay, I think let's take Kaylin Palm. She says she's from Eyewitness News. Kaylin says new Pfizer data has been released about the booster shot. What's the national department's stance on this? Is it something South Africa will be looking into? Can the department indicate whether those with disabilities are going to be prioritized in the country's vaccine program? If so, can you please provide details. I think I'll leave it there for now, and then we'll take the next round. Thank you so much. Our panelists will then, I suppose, will then take the questions as they've been read out. Thanks.
Thanks, thank you. I'm happy to start in terms of the timeframes. So the reason why there's these different times is it really depends on the quality of the submission. And so if the data is adequate, it goes through quite a quick process. But if there's going to be quite a bit of back and forth with the applicant, it does take some time. And also, we would issue what we call queries to the applicants where we provide them with a list of questions. And it depends how long they take to come back to SAPRA on those questions. The other important thing is the site assessment. If the site is in good GMP, so good manufacturing status, they've got a certificate in place that is still valid. And when we do a desktop review, there aren't any queries, that typically goes quickly. So it really depends on what the applicant provides us. Thank you.
Thank you very much. Thank you very much. I think I would like to respond to the one where they wanted to know if the department has done recommendations. We will be, the Ministerial Advisory Committee will be submitting something to the minister this morning for the minister to then process and then interact with the team and then start preparing for presentation to the National Coronavirus Command Council. It will be at that time that then there will be a decision that will be made. So the Ministerial Advisory Committee did meet already, and they will be giving us something for our minister this morning. And then there was a one on the registration that would be starting for the 35 plus. We really would like to start with registration and then stagger the starting of the actual vaccination as we move forward. But we'll be monitoring the situation as the registrations are starting to see how is the progress going. I think those are the two that I'd like to take, and then Dr. Crisp will take the other ones. Thank you very much.
Thank you very much, DG, and thanks for the questions. I can answer some of them. So there was a question asked, I think it was Heidi, about how much stock do we have. So as of day before yesterday evening, so yesterday early morning, the country, we had all told, both Johnson & Johnson and Pfizer vaccine in the country, 3.6 million doses, which at the current rate of vaccination that's gearing up is about 18 days of vaccine in the country. Now we do get vaccine, and that vaccine is, some of it is still in the central distributor. And then there's obviously vaccine all the way through in the central hospitals, the tertiary hospitals, right the way down into the clinics and the community health centers. Every day, and in the private sector, there's also vaccine that's in their central wholesale in the private hospitals and through the various community pharmacies and so forth. So that's what's in fridges at the moment. And we get a report every day at the end of the day through our stock visibility system of what vaccines have been used, and we track what is used against the reported vaccine doses that are reported on the EVDS to check what's happening and to watch if we, how much loss, how much wastage we are getting. So as we stand at the moment, that's about 18 days of vaccine, which is the strongest position we've ever been in. But the pipeline going forward is for the Pfizer vaccine, we had visibility until the 26th of July of the deliveries. And then this morning, we have just received some information about the coming period into August. So we will, that at least gives us vaccine security. For the Johnson & Johnson vaccine, the reason those figures are not in the general population stats is because that is the short expiry date vaccine, the 1.5 million doses that we got when the vaccine was released into, by the FDA process. And that we are using in the dedicated cluster or the department programs. So we're not putting it into the general population yet until we've reestablished the whole pipeline of vaccinations from Johnson & Johnson, which we hope to sort out by early next week. And then in next week's briefing, we can give a more detailed report of what's happening. There is progress there, but it's not in sufficient detail for us to be communicating now. The low turnout of 60 plus. So what we see in most countries is that any vaccination program that reaches more than 70% of any population is doing well, and it is more difficult in the older part of the population. So we are hoping that, and we're already starting to see the trend, that when the 50 plus population comes in, and I suspect the younger population too, they will bring a lot of the older people. But there are initiatives. There's a very encouraging pilot project that's been running in the pension pay points this week, and I'm sure that we'll get feedback on that, and whatever lessons have been learned there will be extended into that process. So those are just some of the initiatives to get to the 60 pluses. But we want to encourage everyone to help the older people in the community to get to where we're going. There were questions around the Pfizer boost shot. We've also seen those reports, but we've also seen reports about mixing and matching vaccines. We've also seen from Professor D'Oliveira this morning that even the single dose of Pfizer already gives remarkable immunity to keep people out of hospitals. So we will be advised in due course when the Ministerial Advisory Committee reports to the Minister on their deliberations. The question of prioritization, the acting minister did speak to this in the beginning. It's extremely difficult to prioritize any group, and that is the reason why we have proposed that we should open to other age groups faster, because rather than spending effort on trying to selectively identify and define any particular group, it's far better to go as quickly as possible through the general age groups and to not spend time on the administration of the program, rather on the vaccination of people. So the general trend is not to try and set up specifically prioritized programs. That's where we are in the rollout at the moment. And I think those are the questions that I could answer. Thank you.
Okay, thank you so much, Dr. Crisp. There are some questions, but we are actually out of time. And I thought our panelists have responded to some of them. I'll just hand over to Minister to just give us some of the responses there.
Maybe let's check if DM has questions that you'd want to answer first before I respond on other answers, and then we'll close.
Thanks, Minister. No, I think I'll cover in my closing remarks any additional response. Thank you. Just to save time.
Okay, thank you very much. I think let me firstly respond broadly on the issues around recommendations to NCCC. The process is that we look at the trend for 7 days, and then out of that, we also receive MEC advisory. After receiving MEC advisory with the data analysis from report that NICD produces for us and all the teams look at, then we compile a report to NCCC. So we currently at that process where we are looking at data analysis of how the pandemic has been doing over a 7-day period. Secondly, it's the issue around the MEC. I've not received the latest MEC advisory, which the DG was clarifying that I should be able to receive it today. Out of that, we'll compile a report that we send to NCCC. So that's the process. We don't want to be preemptive. We've not had that process to finalize. Once we are done, we will be able to, and NCCC will pronounce on itself. I spoke about the mobilization in terms of making sure that all that needs to be vaccinated, all the population or citizens that needs to be vaccinated are vaccinated. We will not neglect the 60 plus population. They remain critical for us. So one of the things, as I spoke to, was around ensuring that in the provinces, there's innovation around how we mobilize. We made an example previously of Limpopo. Today, we made an example of what Gauteng is. We are paying attention to other provinces like Western Cape, Eastern Cape, and Northwest, Northern Cape, and Mpumalanga. But what we want to do now, we're starting to drill down to each and every district, looking at the population, looking at the vaccination numbers. And one of the things the IMC has said is that the district champions need to be given this information to say, in your district, this is what is happening. If vaccine rollout is low, this is what the numbers are, so that the champions can help us in making sure that as they sit in these command councils, they are able to talk to the district command councils, they are able to talk to the communities in those districts and drive the vaccination program. We are not saying that there are no mistakes. We are not saying that there are no flaws or even things that we need to correct. I think as we go, South Africans need to understand that it's a rollout that we are also learning in other areas. So where you find glitches, please do give us feedback, but be patient with us. Don't be impatient. We'll be able to correct those. So that's it from me in terms of responding to the issues, and allow the DM to take over and close the session. Thank you very much, DM.
Thank you very much, Minister. Greetings to all the panelists, DG, and the team, Dr. Crisp, and other experts who have been on the panel, Prof. Tulio de Oliveira. Once again, let me thank all our frontline workers who continue to soldier on in saving lives of South Africans as we battle this third wave of COVID-19. We appreciate your efforts and sacrifices as you risk your lives and those of your loved ones on a daily basis. We wish to assure you that as a national department, and also with our colleagues in all the provinces, and as the whole of government led by our president, we are doing everything possible to support all our health facilities and our health workers. We are leaving no stone unturned in making sure that we have the necessary hospital beds, the oxygen, ventilators, personal protective equipment, and all other commodities. And above all, to make sure that we're providing the necessary funding for the hiring of more health workers. And in this regard, I'm pleased to announce that we have also been able to deal with the thorny issue of unemployed medical interns. Thanks to support also from the Ministry of Finance and National Treasury, we can announce today, in fact, the circular went out yesterday to indicate to the public, to inform all our medical interns who are still waiting for placements, that they've all been placed and they can be able to view their placements on our national system. So this is a major step forward in dealing with that problem. And as indicated by Prof. de Oliveira and also Dr. Klute from the Western Cape, the number of infections driven by the Delta variant is rising exponentially on a daily basis, driving up admissions in hospital and therefore flooding our hospital capacity. It is therefore important that as members of the public, we continue to do everything possible to protect ourselves so that we can enable our hospitals and our health workers to be able to cope. We are encouraged by the increased stability of vaccine availability, as reported by Dr. Nicholas Crisp, and also the increasing rate of vaccinations. As announced earlier on by Minister Kubai, from the 15th of July, we are opening registration for the 35 years and above. We would want to urge this cohort together with all others, the 50 plus, and continuing also with the 60 plus as much as possible, so that to enable you not to wait for long when you go for your vaccination, to first register. Only in circumstances where there's maybe for reasons which you are not able to deal with, you are unable to register, then you can walk in, but we would prefer that people do register and wait for the bookings. But if you are registered and it takes too long, you can approach your nearest vaccination center to be vaccinated. but we would prefer that as much as possible that people should first register. That just makes it much easier and even makes it possible that you don't wait for too long. We are pleased that with the ever increasing turnout of the 50 plus, the 60 plus, and now with the 35 plus who will be registering, we're expecting even more numbers to come forward to vaccinate. We believe that this opening of the 35 plus will provide a lot more impetus. And indeed, we're hoping that this younger population will also be bringing their older peers, their parents and uncles and so on of the over 50 and the over 60s. Together with this, as Dr. Crisp has indicated, in parallel, we are also ramping up vaccinations in the workplaces. And we are very confident that before the end of July, as we already indicated that we are already at a figure of around 190, just approaching 200,000 per day of vaccinations. We are very confident that before the end of the month, we should surpass 250,000 per day. And by the time we reach August, we should be able to reach the target set by our president of 300,000 per day. In conclusion, I want to again urge all South Africans to continue to observe the proven methods of prevention of COVID-19, of safety by use of masks, washing our hands and sanitizing, physical distancing, and also avoiding crowds. Together, we can indeed overcome this COVID-19, especially the third wave. Thank you very much. Thank you.
Thank you so much, Deputy Minister. Ladies and gentlemen, I think this brings us to a close now. I would like to really thank our panelists. Thank you, Minister DM, DG, and the DDGs, including our panel of experts. We really appreciate the fact that you're always, willing to come through even at last minute and, so that we keep the nation updated on what is actually happening